Hi everyone, welcome back to our channel Dentistry to the Point. This is Dr. Dhrumil Manek. So next we'll move on further to the topics of benign tumors of epithelial tissue origin. So the next topic for our discussion is oral nevi. Now what is oral nevi? We can say that oral nevi is a congenital, developmental or tumor-like malformation of skin or mucous membrane. क्या है? Congenital है, developmental, tumor-like malformation of skin or mucous membrane, or in simple words you can also say that it is just a benign proliferation. क्या है? ये एक benign tumor है. So it is a benign proliferation of nevus cell into the epithelium or connective tissue. क्या है? Benign proliferation of nevus cell into the epithelium or connective tissue. Now why this word nevi, or from where this word nevus is coming? So specifically nevus cells are the neuroectodermal cells. They are of neuroectodermal origin. Now their work is to produce the pigment that is melanin. In nevus cells का काम क्या है कि melanin pigment का production करना. Now as these are neuroectodermal in origin, when they are produced, they reach their specific site, that is the basal layer of skin and mucous membrane. जो भी basal layer रहेगी skin और mucous membrane की, वहाँ जाके they are going to settle down and they are going to start their production of melanin. Now the production of melanin is dependent on various factors, but this, when the production of melanin pigment is excessive or it is not in the control of the body, then this leads to an tumor, that is oral nevi, or in simple words, in Latin the term nevus means birthmark, or you are well aware of the name that is mole, that is the birthmark or mole which are seen in many of the individuals. So that is nothing but that is called nevus, which occurs on skin, and that form of nevus also occurs in the oral cavity. So there are various names given for oral nevi, that is oral melanocytic nevus, या फिर mole, or nevocellular nevus, then mucosal melanocytic nevi. Now see, this is oral melanocytic nevus, that is those nevus cells which are producing melanin pigment in the oral cavity, or you can also call it as mole, which is present on the skin. Next is nevocellular nevus, mucosal melanocytic nevi. So these are the another names or different names of oral nevi or nevi. Now it is just an benign proliferation of nevus cells in epithelium or connective tissue. In Latin the term nevus means birthmark, and another term used is mole, which we are well aware of this. Now nevi are categorized into two categories clinically, that is the congenital and the acquired. Congenital, which is present from birth; acquired, which is occurred or acquired after the birth. So now this acquired category of nevi is again categorized into three histological variants, mainly that is junctional, compound or intradermal, or you can also call it as intramucosal. Whichever part is occurring in the skin, it is called as intradermal. जो भी स्किन में होगा वो इंट्राडर्मल कहेंगे, जो भी म्यूकोजा में अफेक्ट करेगा दैट विल बी योर इंट्राम्यूकोजल. सो इट इज क्वाइट सिंपल, जंक्शनल, कंपाउंड एंड इंट्राडर्मल और इंट्राम्यूकोजल. नाउ व्हाई आर दिस नेम्स गिवन, दैट इज जंक्शनल, कंपाउंड एंड इंट्राडर्मल और इंट्राम्यूकोजल. सो द जंक्शनल नेम इज गिवन बिकॉज that is the presence or the location of nevus cells in the structure. That is, in the junctional variant the nevus cells are present at the basal cell layer of the epithelium. In the compound variant the nevus cells are present in dermis as well as the epidermis. In the intradermal or intramucosal, then the nevus cells are present only in the dermis or in the mucosa. So these are the three variants of acquired nevi. These are the histological variants of acquired nevi, that is junctional, compound and intradermal or intramucosal. Now if we talk about the oral variant of all this, that is oral acquired junctional, oral compound or oral intramucosal. So it is first noted in infants and children. The junctional variety is first noted in children and young adults, or infants, children and young adults. Then this junctional variant will only mature into a compound nevi. This junctional variant which was present in infant, children and young adults, after some time it is going to mature into a compound nevi. After that this intramucosal variant, next after this they are going to convert it into, then later in the adulthood, after some more time or after some ages, then this later it is converted into intramucosal variant. So this is the course of the, and this is also going to remain same in the skin of the nevi, that is the nevi which is occurring in the dermal region, that is in the skin and also in the mucosal. Firstly it will be in junctional form, then converted into the compound form, and next converted into intramucosal form. Now intramucosal form is considered to be the most common type of the oral nevi, which intramucosal variant is considered to be the most common type of oral nevi. Blue nevus is considered to be the second most common, and lastly oral, that is the junctional and compound nevi, only account of 3 to 6% of cases. So these are considered as least common. The junctional and compound nevi occurring in the oral cavity are considered as least common, showing the 3 to 6% of cases. So this was a basic introduction regarding what is nevi, oral nevi, the nevi occurring in the skin, the birthmark, the varieties, that is congenital and acquired, and junctional, compound and intradermal, that is the histological variants. We saw the course, that is how junctional is converted to compound and then intradermal or intramucosal. Next, moving on to the clinical features of nevi, that is firstly we will discuss about the congenital and acquired nevus broadly. So the congenital nevus is divided into two categories, that is the small and garment category. कौन सी categories है? एक है small category and second one is your garment category. Now the small category is usually 3 to 5 centimeter in diameter, that is the lesions are not much big and they are not going to cover the vast areas of the skin. The garment type is of 10 centimeter in diameter, so these are capable of covering the large or major areas of the skin. Now initially the lesion is flat, pale and in the form of tan macules. Initially कैसा रहेगा lesion? In the form of flat, pale, tan macules, and then they are converted, after some time they are converted into elevated, verrucous, hairy lesions. First they are flat, pale and tan, that is macules, and then they are converted into elevated, verrucous, hairy lesions. Commonly they are occurring on the skin of head and neck, and rarely they are occurring intraorally. The congenital nevus are commonly seen on the head and neck, that is the skin of head and neck, and rarely they are seen intraorally. So this was about the congenital nevus, the two varieties, that is small and garment, the size and the clinical presentation. Next, the acquired nevus. Now acquired nevus begins, now this is acquired after birth, so this is not going to be present at the time of birth. After some time it is going to appear, that is it begins in the 8th month of life. कब start होगा? At the 8th month of life, and then it increases with number as the age increases. जैसे age बढ़ती जाएगी, the number of acquired nevus or acquired nevi present in the body are going to increase, until the 3rd decade of life it is going to reach its peak. मतलब maximum number of nevi has occurred till the age of 3rd decade of life. In a single patient 3rd decade तक वो peak तक पहुंचेगा. Next they are again going to decrease with increasing the age. As the age of the patient increases, then the number of nevi again decreases. So you can see that the nevi present are more in younger adults and there are less in the older individuals. जो भी young patients रहेंगे उनमें ज़्यादा देखने को मिलेंगे. There will be more less common in the older individuals.